What you can do as a nurse case manager without working inside of a hospital. Hi, my name is Brianna. I am your nurse career strategist, nurse innovator, and dream facilitator. And in this episode, I want to give you tangible tips as to how to explore, understand, and apply your ability to operate as a nurse case manager without working in the hospital. First, let's talk about what case management is. Now, I haven't Googled or went online to look for an exact definition of case management to read out for this video, but I will define it based on my experience and what nurse case managers typically do, regardless of the setting that they are practicing in. As a nurse case manager, you have the ability to manage caseloads or groups of patients from the beginning to the end of their treatment course or treatment plan. You are responsible for care coordination, filling gaps related to psychosocial issues, health care related issues, or discharge related issues, even if this is a patient that is being discharged from an outpatient setting. So you likely know that case management can be hospital-based, but case management can also be performed in community health, in insurance, working for insurance companies, in workers' compensation, in home health, remote, and sometimes in the modality of both, working from home and then going out into the field, or some days working in the office and some days working home. Case management can also be disease specific. So you might be dealing with patients who are diabetic. So your case management is specifically related to their diabetes care. As I previously stated, a nurse case manager can be going into the office and then reporting for the day and seeing patients inside of their clinic during that day. The nurse might also be seeing patients that are not able to leave their homes and are expecting the nurse to come to their home and assess them inside of their home. Provide direct patient care, whether that's for the nurse to provide it themselves or the medical assistant or someone else that is a part of that patient's healthcare team. A nurse case manager can be getting up out of their bed in the morning and walking across the hallway to their office to perform education, perform chart reviews, and report to their team from just simply working at home. Case managers often do meet with the person that they report to, whether that is a nurse lead manager, a team lead, or a physician, and they're reporting out on the status of their patients. This could be on a weekly basis, on a monthly basis. It really definitely depends. According to ONET Online, the United States Bureau of Labor and Statistics, a nurse case manager can make anywhere from $73,000 to over $100K annually. And of course, this always depends on the nurse's experience. I'll leave a link to that website in the description. Honestly, if you are a newer nurse or a nurse with most of your experience being at the bedside, getting some simple care coordination experience can start to qualify you for roles that allow you to operate in a case management capacity, especially for the roles that do not require case management certification. Care coordination and case management activities often overlap, so that is a great opportunity for the nurse who is a care coordinator to start to position themselves for nurse case management roles. Absolutely. There is too many opportunities and variation in role responsibilities and needs of different healthcare facilities that require nurses to operate in. Therefore, yes, an LPN can also operate as a nurse case manager. Because there are varying job titles where the nurse can operate in case management and care coordination capacity, I will leave a list of different kinds of nursing job titles for you to search for, different keywords to look for to start to open up your search for transitioning to a non-traditional role after your experience at the bedside. I enjoy helping nurses transition into non-traditional roles, and I created the Nursing Next Navigator to help nurses in their journey towards a non-traditional career path. Once you complete that, you'll get customized output as to where you are right now and how that experience can translate into a role that might actually fit where you're headed and where you desire to be. That's all I have for you in this episode. I will see you guys on the next one. Bye.